All right, if we're all set. All right. Dr. Sarah Wills is a dedicated veterinarian with a focus on exotic and wildlife medicine. She earned her master's degree from Texas A&M University before completing her DVM at Ross University School of Veterinary Medicine and clinical training at Tufts Cummings School of Veterinary Medicine. After graduation, she pursued 2 specialty internships in zoo, exotic, and wildlife medicine. For the past 10 years, Dr. Wills has worked in exotic companion practice while also facilitating PBL sessions for first and second year students and overseeing SRI for fourth-year students. Having presented at various conferences and published several papers, she brings a wealth of knowledge and experience to the field of exotic veterinary care. With that, please join me in welcoming Dr. Wills.
Hello. So I know most everybody here, I've either had you in one of my groups or in clinical skills. So I am Dr. Wills. I am currently facilitating and hope to be continuing to do that. So my presentation today is going to be kind of about the welfare concerns associated with our exotic companion mammals and then the bird species. We left out reptiles since everybody's kind of already gotten some reptiles, and that's, one of the more common things that we hear about as far as husbandry and things like that. So basically in my presentation, bless you, I want it to be interactive, so I'm going to ask you all questions. So be prepared to shout out answers. And then basically what we're going to do is I tried to refrain from putting a ton of like sentences on my slides. So it's going to be more of a discussion. So basically we'll talk about some of the common species, different problems that we see in clinical medicine, and then how we mitigate those issues. This talk in and of itself could be like 2 full days or more because there's so much. So I just try to touch on like kind of the main things. But obviously, if you do have questions, I'll take questions afterwards. And then while we're eating, feel free to grab me around the school. So I'm always here. Let's see if I can work the technology. Am I pressing the right button? Okay, let's see. Technology, not my jam. So we'll start with birds. So some avian considerations. So there's a bunch of different species of birds, obviously. So that's going to be a consideration. And then also where they come from originally. Also, that's going to play a big role in kind of what they eat, if they're flighted or not flighted in captivity. And then also signs of pain and things like that. I have a whole separate presentation on pain in birds, so that we won't kind of go too deep into, but so those are all things to consider when working with birds. I always tell people, so exotic companion mammals, you can work in cat dog and still do a great job seeing the occasional small exotic companion mammal, rat, rabbit, whatever. Birds, you either do birds or you don't do birds. So there's no dabbling into avian medicine. You've got to know what you're doing. So, yes. Okay. So for species, so we've got cetacine birds, which are obviously by far the most common birds that you're going to see. So those are our parrot species. We also have chickens and things like that. Depending on what's going on, you may or may not see chickens, even if you see birds. So when there was the Newcastle outbreak, none of us were allowed to have chickens in our hospital. You just had to immediately call the state veterinarian. So right now with avian influenza, even though it's not in this area, the last sick chicken I actually examined in full PPE out in the parking lot, which was great because people were like driving by, like, hey, as I'm trying to draw blood from this chicken. So, but those are all things to consider. But you may see chickens. Chickens are really popular pet here as backyard chickens, especially now that eggs are like $1,000 a dozen. So, passerines, bless you. You will probably see the occasional sparrow, things like that. And then as far as like ducks, raptors, depending on your clinic, you may or may not get some of them in there. So we have a vet tech who does wildlife rehab. So we see a fair amount of raptors as well. So, and I did some raptor medicine. So I do love the owls. So we'll start with parrots, and let me know how I'm doing on time because I'm a talker, as we all know. Those people that had me in PBL, not good at staying on track. So there's like a million different parrot species. So basically, depending on how you classify them, a lot of people classify them into either old world parrots or new world parrots. And basically what that means, the old world parrots are more of our like African, Asian, European. New world is the new world. So like North and South America, and then to some degree, the Pacific. That's going to make a big difference because your new world parrots are going to be much more tropical species. So they need warmth, they need humidity, they have a somewhat different diet, kind of. So the old world are going to be your African birds, your Australian birds, and they're adapted to a much more hot and arid climate. Again, somewhat depending on the species. So that makes a big difference. Cute little hyacinth macaw, and then a screaming cockatoo, because that's what they do. And that's one of their behaviors that we need to mitigate. All right, so diet. So what should parrots be fed? Parrots should be fed mostly a really high quality pelleted diet with a lot of fresh fruits and vegetables in a wide variety. The only thing these guys cannot eat are onions, garlic, chocolate, and avocados. And avocado, interestingly, not all avocados are toxic, only certain species of avocados, but we say no avocados in general because it's going to be difficult to tell people, okay, well, you can feed this avocado, but not this one. So, but in the wild, you will see them munching on avocados. So, those are really the only things that are toxic. Otherwise, they can eat everything. The more colors, the better. So, squashes, peppers, they love jalapenos. So, any of those things, anything that's red, orange, yellow specifically has a lot of vitamin A and is really good for their overall health. So, what do captive parrots usually eat? Seeds. Yep. Specifically sunflower and safflower, which have really no nutritional value at all and have a lot of fat in them. So, when I'm trying to get my clients to change diet, it's a very slow and gradual process in these guys. They're really picky. Anything new is scary. So sometimes if they see what you're eating, they're more likely to eat it. I try to stay away from seeds in general once we get them weaned off and do more nuts and things like that. An almond, a walnut piece, things like that that have good omega-3 and 6 fatty acids. So, sequela of having a seed diet. So, we get a lot of fatty liver disease that can often manifest as severely overgrown beaks. This little budgie up here probably actually has beak issues because he has scissor beak, but I couldn't find a good picture of a really overgrown beak. But I've seen them curl all the way into the bottom of their neck. So that is often due to liver disease, or we suspect it's liver disease. They also get elevated triglycerides and cholesterol, which can lead to atherosclerosis. So the pathway of atherosclerosis in birds and heart disease is actually very similar to people. And so a lot of studies have been done in birds to kind of see how we can mitigate this. So it's interesting. We do a lot of blood work in these guys. So Avian and Exotic Laboratories is a great laboratory for you to use to send out any of your avian or exotic blood. They actually offer a lipoprotein profile in these guys. So same as we do in people, we get triglycerides, total cholesterol, HDL, LDL, VLDL. Those numbers will be significantly elevated in these birds sometimes. Once we get them on a good diet, within 6 months, you can see those numbers decrease exponentially. And we've actually CT'd some of them and seen that the amount of plaque in their arteries will correlate with that. So it does decrease. Unfortunately, in older birds that have had this, they have a lot of atherosclerosis. Sudden death is the most common clinical sign. So the owner's like, he was eating, he was chirping, he was doing just fine, woke up and found him dead in the bottom of the cage. Always a possibility. So I always warn my people about that. Heat and lighting. So heat, very important for these guys. Again, remember, most of them are tropical species. People are like, I'm worried about them being too hot. They live where it's 90 degrees and humid. I lived in Belize. It's 1,000 degrees there all the time. So in Africa, obviously, it does get colder at night and during certain seasons. So those birds can have a little bit lower temperature. But in order for the metabolism to function appropriately and for them to stay well, they really need good heat. We also now know that UVB lighting is actually really important, not just in reptiles, but in birds as well. It's really important for bone growth and health, as you may imagine, because of the vitamin D conversion. And then just also to help regulate their light-dark cycle and things like that. So in birds, we often use the reptile bulb still. They may make an avian bulb, I'm not sure, but I just tell my clients to get the 4 or like 8.0 depending bulb. And then you want to make sure that it's in a container so that it's not too close to the cage. And then I just have them clamp it on the side of the cage away, and you can just measure the temperature with the thermometer. And you can get the heat UV mixed bulbs. So, and my birds that have those do much better. Their feather quality is much better. So that is an important thing. We're going to touch on reproduction in a minute, but light-dark cycle is very important for that. So another thing that happens is birds in captivity get bored. In the wild, they live their life foraging for food, mating, sleeping. That's essentially their whole life. So they're always on the go, always busy. So in captivity, it's really important for us to provide different things for them to forage and do. So Scott Eccles is an avian specialist. He made this video like a long time ago. We used to give it out to all of our clients, but now it's on YouTube for free. So you can just Google captive foraging by Dr. Scott Eccles. And it's a really great video that talks about foraging, why it's important, and then gives you ideas for making different foraging things. I tell my clients, you do not have to buy these fancy toys. Get a tissue box and like put some goodies in it and then stick stuff in it. Although, caveat, you do have to be careful if you have a female bird, because then sometimes they use that material to try to make nests. So just keep that in mind. So, but it doesn't have to be anything fancy. A paper towel roll with stuff shoved in it. So they're completely happy. So with foraging, this will help mitigate undesirable behaviors, especially in cockatoos. Cockatoos love to scream and make a ruckus. They also love to prolapse their cloaca. And so some of the bad reproductive behaviors or other bad behaviors can be mitigated by just doing some active foraging with these guys. All right, perching. Perching is very important. So you should provide a variety of different perches. So wood is often the best. You do not have to buy fancy manzanilla wood or anything like that. Go out in your backyard, pick up a stick, as long as it's an appropriate size. wash it in hot soapy water, bake it in the oven at 200 degrees for like 10 minutes, or set it out in the sun to dry. It kills out all the parasites and everything else. Works perfectly for the cage. So you want to make sure that the size is appropriate for the foot of the bird. So it's going to be, you want them to be able to wrap their little claws around it, but not be too open and not trying to be too closed. I never recommend sandpaper, cement, or any of those things. It does not help file the nails and actually can lead to foot sores or pododermatitis. So wood is best. Ropes are great. So no dowels either. They're too smooth. And again, they can lead to pododermatitis. Perching is also important because birds that are in the wild, when they're sitting on the tree after they've eaten, that's how they clean their beaks off so that they don't get mites and things like that. Reproductive behavior. So birds like to mate. That's what they do. Some species more than other. Cockatiels, budgies, they're like egg-laying fiends. As I'm sure all of you know, female birds do not need a male to lay eggs. They just won't be fertile, but they unfortunately can have a lot of negative sequelae. So one is that they can become hypocalcemic if they don't have the appropriate amount of calcium, and then they can die if it's bad enough. It also leads to egg binding, which sometimes if you give them some fluids, some heat, some calcium, we can actually get them to lay their eggs without any issues. Sometimes we have to go in and take them out. Also, periosteal hyperostosis is a common sequela. So basically what happens is because of the chronic estrogen, they lay down excessive calcium in their bones. So you get these thickening of the actual like shafts of the bones. Not super comfortable or good for the birds. And then it's also not available for them to use when they go to have babies. And so they can get hypocalcemia. So for pain in these guys, obviously in birds, it's always really tricky to diagnose or like see when they're painful. They're really good at hiding their signs of pain. In the wild, some birds like lapwings actually pretend to be sick or broken in order to like protect their young. So it can be a defense mechanism. But usually what I tell my clients is anytime you've got a like fluffed, lethargic, sitting in the bottom of the cage bird, they are dying. So because they have probably been sick for a while and just not shown any clinical signs. So those are always emergencies.
If this is okay, there we go. A couple of questions. For the periosteal hyperostosis that you mentioned when birds are reproductively active, does that count, or is that considered medullary bone, or is that different?
It is so it encroaches into the medullary cavity, but it's more of like the why is my brain not working right now? It's like on the sides, but it does encroach into the medullary cavity. So it also reduces the diameter and production in the medullary cavity itself.
Okay. Would that, in that case, like lead to, hang on, the term's not coming to me, lower blood levels, essentially, like lower red blood cell levels?
So it can, yep. So it absolutely can. So they can be anemic, although oftentimes if they're having increased estrogen, they're also anemic anyway.
And then my second question was, sorry, but so I've worked with birds a little bit, as you know.
Yep.
How often do you see toxicity issues in birds from chewing on the house or inappropriate things in their cage and things like that?
So since now most of the cages and toys and things are no longer made from leather zinc, still get some out there because obviously there are some birds that are kept in really old enclosures and things like that. We see a lot less. The big problem is, though, we do see a fair amount of lead intoxication in birds that are allowed to roam the house because they chew on the baseboards and on the wall. And in California, particularly, anything that was built before like 1970 probably still has lead-based paint. So we've had actually a fair amount of birds and mammals that have been intoxicated. We had 2 rabbits that got hemolytic anemia that we had to treat. So anything that comes in anemic and weak, lead intoxication should be on your list. So, but less common, we used to see it a lot when the cages were made out of like zinc and lead and things like that. So I'm not quite that old. So, but I was kind of when I was working as a technician, we would see some come in. So, all right, small mammals. So obviously there's a bunch of different small mammal species. Many of them are illegal in California. However, you will still see them in practice. So I see a bajillion ferrets. So the occasional sugar glider and things like that, and the occasional gerbil. Our job as veterinarians is we do not have to report anything. Our job is to take care of the animal. So as long as it is otherwise healthy and you're bringing it for an exam, I don't care where you got it or whatever. So that's not my problem. So we'll start kind of with the most common species. So obviously rabbits. If you work in exotic practice or even in general practice, you're going to see a bunch of rabbits. There's a million rabbits in California. So rabbits in and of themselves have many, many different breeds. They're obviously herbivores. They need a very specific diet. So they need to be eating about 80 to 85% good quality hay. I have no preferences when it comes to adult hay. I already tell everybody. So Timothy, brome, oat, whatever, as long as it's not alfalfa. Because as you all know, what does alfalfa have in it? Yell it out. I'm deaf. Protein. What else? Calcium. Yeah. So rabbits, guinea pigs, chinchillas, all super prone to getting bladder and urinary stones and sludge. So no alfalfa. Plus they get fat. And then also the high protein gives them diarrhea, which is not good. Then they can't eat their cecotrophs and then they go into stasis and dysbiosis. So lots of good high quality hay, little bit of pellets, little bit of salad. So I am on so we'll touch on it in a minute, but urinary tract disease, again, stone sludge, really common. We do not know why this happens. We know that these guys process their calcium differently, and so they're able to excrete it in high levels in their urine. We do not know why they get stones. So we suspect there's a genetic component, but then also as well, some sort of environmental component. So because we see rabbits that literally like the worst diet and never get a bladder stone, and then we have rabbits that are like on the most perfect diet in the world, get only bottled water and still develop bladder stones. So if someone can figure out what that actual pathway is, you will be a bajillionaire, because especially in guinea pigs, so many bladder stones. So generally speaking, I recommend, as far as like if you're doing salads, none of the like calcium oxalate rich vegetables. So no spinach, kale, cilantro, parsley, mustard greens, collard greens, things like that. Stick with the good leafy lettuces. But that will help mitigate some of those diseases. Also, lots of dental disease. They need to eat a lot of hay. Their teeth are open rooted. They grow continuously. So, and that is also true, obviously, of our guinea pigs and chinchillas. They need that hay and that grinding motion to really wear down their teeth. So very, very important for dental health. If not, then we have to trim them. That's very expensive. So uterine disease, rabbits. So female rabbits that are not spayed before they're 2 years old have a 98% chance of developing uterine and or mammary gland cancer, and it metastasizes everywhere. I've seen it in the spine. I've seen it in the most commonly the lungs, but I've seen it in the spine. I've seen it in the GI tract. I've seen it in the bones. It goes everywhere. So very, very important to have them spayed. You will have people come to your hospital that are like, my doctor told me that if I put my rabbit under anesthesia, it's going to die. Rabbits are tricky anesthetic candidates. And the reason for that is because they like to stop breathing under anesthesia and they are very difficult to intubate. So they have to be intubated with a scope. I no longer intubate our rabbits and guinea pigs. My technicians are like bomb, and so they just do it for me. So I don't know that I could even intubate one now, but if you run them on mask anesthesia, you run the risk of them holding their breath, going into cardiac arrest, and dying. When you have them intubated, we have an extraordinarily low death rate at our hospital. And what I tell people is there is always a risk, obviously, with surgery and anesthesia. They will 100% die if they're not spayed. So I think on a yearly basis, I see maybe one rabbit that hasn't been spayed that doesn't also have uterine cancer. So really, really important for those guys. They do get a lot of ear disease, especially lop-eared rabbits. They're like the Cocker Spaniels of the rabbit world. Inner middle ear infections, head tilt, circling, nystagmus. So super common in rabbits. We do a lot of head CTs. If it's bad enough, then what we'll do is I don't do the surgery, but I will refer them to a surgeon and we do a peekaboo just like you would do in dogs. So total ear canal ablation and ballosiotomy. So yes. That is a good question. I actually do not. I know obviously in people, having children reduces your risk exponentially. And in some other species, like cats, for instance. I do not know if that is true in rabbits. I would suspect potentially, but unfortunately, the rabbits that are often bred, unless it's an accidental breeding, are not going to live significantly long lives anyway, because they're just being constantly bred for their sad inbred offspring, like our little lion head friend over here, who has all the dental problems in the world if he doesn't get a lot of hay. So yeah, so I don't know, but that is interesting. So I have thought about that as well, and I don't know if I ever actually looked into it, just meant to, or have forgotten, but that's a good point. So they also do get pododermatitis. So especially these guys over here, Rex rabbits, they have this really unique fur coat, and their little feet, unfortunately, lose some of that fur on the bottom, and then they tend to get a lot of foot sores. If you are doing anesthesia on a rabbit, do not ever shave the bottom of their feet to put on the Doppler or anything like that. You will give them pododermatitis. So it's a little, but you have to stay away from the feet. All right, guinea pigs. So our little guinea pig friends, also several different breeds, not as many different breeds as in rabbits. So they have the unique issue that they do need vitamin C supplementation. So you do have to provide exogenous vitamin C for them. So ideally 50 milligrams per day. It's really important for their heart health, dental health, joint health. So diet otherwise pretty much the same as rabbits. Lots of hay, little tiny bit of pellets, bit of salad, and then their vitamin C. Comes in different forms. We use the Child's Life a lot because it's palatable. They like that. Can also do the Oxbow cookies. Oxbow is a great brand. They put a lot of research into their diets. Excuse me. And bless you. As far as disease processes, they get essentially the same diseases. Ovarian cyst is something that are common in guinea pigs. Again, I don't know that we know exactly why they happen with such frequency. If they are functional cysts, then we will treat them with hormone therapy. Usually works really, really well. They do get more bladder stones and sludge than even rabbits. Sometimes we can cause them to break down, pass on their own. Sometimes we have to go in and surgically remove them, unfortunately. And guinea pigs have the unique ability to make a new stone as little as 2 weeks after you've removed the old one. So you always need to warn the owners about that. Because they'll be real mad if you take their guinea pig to surgery and then they get a new stone in 2 weeks and you have not warned them. Otherwise, arthritis, as Amy knows, poor little guinea pigs get so much arthritis, like 2.5. So they live to be about 5 or 6. I have the occasional ones that are 6.5, 7. I have 2 that are 8. They're like Methuselah. They're real old and like they just kind of move around, but they're living their best life. But they can get arthritis as soon as like 2.5 years old. So heart disease, also super duper common in guinea pigs. All of our little exotic friends, whether it's birds, to some degree reptiles, and then especially our little exotic companion mammals, they are really inbred and really overbred. And so they have 1,000 problems. But because we know about these problems with diet and things like that, we can often mitigate some of those or keep them longer. So they respond really well to heart medications, same ones we use in cats and dogs and people, benazepril, Lasix, and eventually pimobendan. So they often can live quite a long time. All right, chinchillas. So, oh, yes. Oh, yes. So they do get GDVs. It's not super common. I would say I've seen probably like 10, maybe in the 15-ish years that I've been doing this. The unfortunate thing about guinea pig GDVs is that they are often not surgically correctable. So you can go in and surgically correct them and tack the stomach. They almost all, I think there's maybe ever been one that's lived post-op and they died a few days later. So for whatever reason, that particular surgery just does not go well in guinea pigs. So if I suspect it's a GDV, so they get the same kind of signs, the double bubble, their stomach is giant, filled with gas and things like that. They're usually not eating, they cannot vomit, so they're just grinding their teeth and things. If they're otherwise active and alert and doing okay and the owner's not ready, sometimes I'll put them on heavy duty pain meds with the hopes that it'll untours on its own. We've had a couple that has happened, and they go back to eating and totally do well. And I'm sure they eventually tours again because that's usually what happens. But if we have a GDV, they're usually, by the time they come in, because it happens so quickly, they're like minimally responsive. Their temperature is really low. Then I just recommend euthanasia from the get-go. There's really no point in taking them to surgery. So unfortunately, so chinchillas. So we don't see a ton of chinchillas. We see a fair amount, I guess. Same kind of things. Hindgut fermenters need the same kind of diet, lots of hay. Interestingly, chinchillas can eat raisins. So this one looks a little unkempt, but he's eating a raisin. So that's why he's up there. They do not get raisin toxicity. So, and they love them. Obviously, lots of sugar, so you shouldn't give them a lot, but it's a good treat for them. They do have a lot of heart disease. So heart murmurs are really common in chinchillas. Sometimes they can just be physiological and not actually be causing an issue, but oftentimes they are pathological. Always recommend working them up. Fur rings is a unique chinchilla issue. So basically what happens is they rub their little penis on things and then they get fur tied around it. And if you don't remove it, then it cuts off the circulation and then you have to amputate their penis. So, so they'll come in frequently. Literally, it sounds weird, but all you have to do is extrude the penis. You just pull or cut the little fur ring off, and then they just suck it back in and go on living their best life. Once they've had one, they often get them. So I'm like, bring them in every 3 months for us to check them. And so, but it literally, sometimes you have to sedate them if it's really bad, but you can just cut them off and it's fine. So yeah, that's a unique chinchilla thing. So otherwise, they also get a lot of dental disease. Yes. So you have to make, so it's basically like a PU. You have to like make a urethral opening. I have not ever had to amputate one, and that is not a surgery I would feel comfortable with, so I would turf it somewhere else. But yeah, you have to make a new urethral opening. So it's basically like the same as in chronically blocked cats. Again, uncommon, so, but does occasionally happen. But always check their penis. So, all right, rats and mice. So you'll probably see a fair amount of rats if you do any exotics. Rarely do we see mice. So most of them come from laboratory breeding stock. So they unfortunately only live to be about 2 usually, although I do have some 3-year-old rats. They get a lot of pneumonia. Respiratory disease is their jam. They just live in this constant state of respiratory disease. So usually it gets better and then will eventually come back. So they kind of are on and off antibiotics intermittently. We use a lot of nebulizing in exotics. It is a great modality that I do not know why they don't use in cat, dog more and people. So, because you're basically delivering the antibiotics directly to where they need to go, and the humidity is helping break up all the goo. Works really well. So, in guinea pigs and rats and mice. Tumors are obviously the most common thing that they get. Almost all of them get tumors eventually. What's the difference between rats and mice when it comes to mammary tumors, which is by far the most common tumor they get? Yes. Yep. So mice get malignant tumors. Remember that? Mice malignant, rats benign. It's almost always a Navli question, FYI. So they can get other tumors like fibrosarcomas and things like that. That is by far way, way less common. It is almost always a mammary gland tumor. They have a really extensive mammary chain. It basically runs from here all the way down into their inguinal area. In rats, even though these tumors are usually benign, they can get really big. And so eventually, if they're not removed, they'll become a functional issue where the rat just honestly cannot move anymore. So I always recommend to remove them. I've removed some pretty large ones, so you have to remove a fair amount of skin and make sure you don't have a lot of dead space, but they will get like yay big. They get really big. So better if you can remove them when they're small, but they are just superficial, so you don't have to go into the body cavity or anything like that. Another common problem is obesity, like this poor little friend here. I would say 9 out of 10 of the rats that I see are fat. So, yes, I say rotund a lot, or I'm like, he's a little chunky. So my colleague, Dr. Laurence, is from Canada. She is she's from Quebec. She's much more blunt than I am. She's like, your animal is fat. So I try to tone it down a little bit. So for these guys, they really should be on a rat mouse specific pelleted diet or block. And then with veggies and things like that. They can get a few pieces of fruits or a few little pieces of nuts and things like that as a treat, but they really need kind of that roughage. And this is a good fortified diet. Obviously, because they're mostly laboratory species, a lot of research has been done into their nutritional requirements. So, and it's easy. Yes. Their incisors grow continuously, but usually they file them down on their own. You will never see their cheek teeth unless they're anesthetized. So, because their mouths are so tiny and they have so much skin that kind of folds over, the only thing we can examine on physical exam is their incisors. If they are not eating appropriate food, then their incisors do get overgrown and we have to trim them. So, but I've never seen a cheek tooth problem in a rat or a mouse. So, so they need a good high quality diet. Mouse, baby Dumbo rat, so cute. So those are kind of the most common things that these guys get. Hamsters and gerbils. So gerbils, if you practice in California, you will probably never see one. So they are an East Coast thing mostly. I've seen a few from owners that have come here from New York. So similar to hamsters. So hamsters, there's a bunch of different breeds. They're kind of little jerks, which is unfortunate because especially like the winter whites and the little Russian dwarfs are like literally this big. So they get a lot of heart disease, bless you. So really, really common in them. Their average lifespan is like 1 to 2 years anyway. Especially the teddy bear hamsters and the robo dwarfs get a lot of tumors as well. They can be anywhere. So intra-abdominal, superficial, things like that. So they are similar to our rabbits and things like that. So rats and mice can get clavamox and all of those kind of drugs for their respiratory disease, which is great. These guys cannot. Think of them as a rabbit. Their hind gut is very, very sensitive. If you cause diarrhea, then it is almost always fatal in them. So, because it is really difficult to sub-Q fluid them even. So, because they're so tiny. So, wet tail in particular is like a general like layperson term that refers to diarrhea. It's caused oftentimes by a spirochete, but that generally is a sequela of poor diet that allows the GI tract to get off balance. So if you do have one that has diarrhea, they need like probiotics, antibiotics, fluids, and just supportive care, and it's hopefully getting them through that. So, but it is often fatal. So again, heart medications work great in these guys. I had a little tiny robo dwarf hamster. I should have put his picture up there, but literally I diagnosed him at like 11 months of age with heart disease, and that thing lived to be over 3. And in fact, he only died when he was having syncopal episodes. I was out of town and he went to one of the referral exotics practices and they gave him too much drugs to take his x-ray and then he just didn't wake up well. So they euthanized him. So they can actually do really, really well on heart medication. So I have a fair amount of hamsters that are on heart meds now. Yes, Logan. They're oral, so it's oral liquid. And these guys actually take a pretty like hefty dose. So it's like 1 unit essentially for these small guys, 2 or 3 units for the big guys. So, but yep, and they're flavored. They usually like them. So, or you can hide them in a little treat of some sort. So that unfortunately is what they usually eat. This diet in and of itself is actually not an awful diet as far as the individual components per se. It's got pellets and some other things in there. It's the ratio. So it's mostly corn and dried fruit bits and things like that. So if it were in a different ratio, it wouldn't really be a terrible diet. People feed this because they love it, obviously, because it's like getting brownies and stuff all day in your food. But it can lead to diarrhea and a lot of health problems. So the oxbow makes a really great hamster diet as well. All right, quickly, ferrets. So ferrets, these are our main kind of coat colors. The differences are, so obviously they're in the weasel family. So we have American ferrets, European ferrets, and then here the black-footed ferrets. So which is trying to make a comeback. My friend that works at the zoo, the Sedgwick County Zoo, does a lot of research with these Blackfoot ferret guys and goes out and traps them and puts radio collars and stuff on them. So they are starting to make a comeback. Ferrets are illegal in California. You will still see them. So, and I know we're trying to get together with a ferret rescue so that you all can get some ferret handling exam experience and things like that. So that should be coming soon, hopefully. So basically, most of our American ferrets come from Marshall farms. They're really inbred, they're really overbred. They all come spayed or neutered. They come with an ear tattoo and they've been descented. We do not know if that's related to the adrenal disease that we see frequently, but we suspect the fact that they're spayed and neutered so young plays a role in that. So adrenal disease for these guys is not your typical like Cushing's. It's actually of the sex hormones. So they also get a million other problems so that we'll touch on. But basically, they're strict carnivores. They need a lot of protein. Cat food is not appropriate for them because they need even a higher amount of protein than cats. So lots of protein, moderate fat, minimal carbohydrates. So Wysong is a great diet. It's well balanced and fortified. They do need taurine like cats or they'll get heart disease. There's a lot of talk about like raw versus commercial. I do not like raw diets just for the fact that in any species, they can induce diarrhea and salmonella, E. coli, things like that. I have had a couple of ferrets that have died from that. The other ones that we treated did fine. So, but some of the semi-raw or like raw that have been like heat treated are totally fine. But just make sure that it's a balanced diet because people will be like, oh, I feed him raw. And you're like, okay, so what components make up the diet? And they're like, I get him chicken at the grocery store. And I'm like, and they're like, no, just chicken. And I'm like, so many nutritional deficiencies. Like, it's not even funny. I'm like, that's not an appropriate diet. Yes. There is not a lot of literature on that. And I am not exactly sure how their specific proteins, like meat versus plant, works in them. So I think as more research comes out in cats, because their digestive tract is so similar, we'll probably get more data on that. Oh, ferrets. I love them so much, but they get every disease known to man. So adrenal disease, by far one of the most common, usually happens after 3. So ferret average lifespan is 6. Sometimes they'll live to be 7. I've had a couple again that were 8, seen maybe 2 that were 9. Those were actually not Marshall Farms ferrets. Those were privately bred ferrets. But adrenal disease, again, we don't know if it comes from the early spaying and neutering, but that's kind of the theory. Insulinoma, we all know about insulinoma. So one of the theories is that because they're fed a lot of like carbohydrate rich diet, we think that that is one of the reasons that they get these insulinomas, and then just poor genetics. But we don't really know the exact pathophys. Heart disease, they can get DCM or HCM. Again, they do great on medications. So same kind of signs that you see in cats and dogs, so murmurs, arrhythmias. Interestingly, though, ferrets get physiological AV block. So if you are listening to a ferret and they drop a heartbeat, it is probably actually normal. So also common in avian species, they can control their own heart rate and rhythm. So AV block, not usually an issue. So but I still always like for them, usually if I hear a significant AV block, I'll say, come back in a couple months, let's listen again and just see. Also, it depends on what the underlying diet and things like that are. Dental disease, they're like little cats. They get a ton of dental disease, gingivitis, their teeth fall out and their mouths are gross. So we do dentals on them, same way you do in cats. So they're just under anesthesia and they scale their teeth, and it's basically the same process. Urinary tract diseases, they do get stones, they get prostate disease. A lot of their urinary tract disease is actually a sequela of their adrenal disease and that sex hormone issue. So sometimes if you can treat them with Lupron, is how we treat that usually, then it will actually resolve the urinary tract problems, because a lot of it is usually due to prostatic hyperplasia kind of squeezing their urethra. So occasionally you see weird things. I had one that I treated for a while and we had to express his bladder. And then as it turns out, he had a tumor inside of his spine. So GI tract disease, ferrets eat everything in the world. They're like little Labrador retrievers. So garbage, whatever. So lots of dietary indiscretion, lots of foreign bodies, all of those kind of things. And then cancer, all the cancer, every cancer you've ever thought of, ferrets get it. So some of it treatable, some of it not. Lymphoma is by far the most common. So we use prednisone. They also can get a CHOP-based protocol, but there's really not a super significant amount of difference in the survival time between prednisone alone. It's usually about 6 months. So, and they have to have indwelling ports put in if you're going to do chemo, because it's tricky to get catheters on them anyway. And when you're doing chemo, it has to be a clean stick. So usually they have to have central lines put in. Ferrets, very curious, get into everything, need a lot of stimulation. So they do get sometimes allergies because they love to stick their head in everything. I tell people, I'm like, every dusty corner that you thought you had vacuumed, the ferret will find it. So this is what they're bred to do. This is what they do in the wild. They hunt rabbits and rodents. So that's why they love crawling through tunnels, because that's what they do in the wild. They have these little radio trackers on. They go into the burrows, kill the rabbit, and pull them out. I didn't put the graphic pictures up here, but this poor rabbit, oh, sad. So, but that's what they do in the wild. So they need a lot of enrichment and things like that. All right, so kind of our key takeaways here. These guys require a lot of very specific husbandry. So specific diet, specific lighting, heat, things like that. It's really important to know your species. Also, know your common diseases. Common things happen commonly in these guys as well. So there's a lot that you can do. Most of these disease processes and the distress that we see in animals and pain are mitigated by just having appropriate diet and husbandry. So that's kind of the main important thing. If you're going to do practice seeing these guys, these are kind of the minimum books that you need. So Spear, avian medicine and surgery, he's kind of like the avian guy. Mater, reptile guy. So that's the old one on the top. This is the newer one on the bottom that's also by Z.E.W. Clinical vet advisor of birds and exotic pets. So that's kind of like a Blackwell 5-minute guide. So really good if you have something weird come in and you're like, oh, ferret. So, and then the exotic animal formulary, ferrets, rabbits, and rodents by Quisenberry. I think that's the newer edition, but all really important books to have and good reference books. So, and then obviously you can contact your people that you know, like me. I'm always happy to give advice. So, all right. Questions. I love snowy owls. Owls in general just always look like they're super angry, and I love that. So, yes, Logan.
All right. So just touching on the inhalable antibiotics, how we were talking about it with, I believe it was the rats. I know we didn't touch on reptiles specifically, but what is your opinion on like F10 respiratory treatments or albuterol treatments in reptiles for those?
Yeah, so F10 has been used for forever in these guys. I remember when I first worked in wildlife, I was like, that is a disinfectant. Like, we're just letting them inhale disinfectant, but it actually works really well and has very few like negative consequences. So reptiles are just a little trickier because they breathe very slow. And so it's not always as effective. You have to be a little careful with snakes as well because of their skin. You can mess up their shed. But otherwise, especially if I have snakes that are not getting better on injectable antibiotics, I will often have people nebulize them. So, because it's a good way to get it into their respiratory tract. Yes, Amy?
I have two questions.
Okay.
First, I know you can give Revolution to like guinea pigs. Does that go across to all of these exotic companions?
Yep. So everybody can get Revolution. Rabbits are the only ones that are very specific. They cannot get frontline, it kills them. So, and then chelonians and indigo snakes cannot get ivermectin. So, but Revolution is across the board pretty safe. I had somebody bring me a chicken that they were like, there's something wrong with its face. And I was like, oh, that's weird. And so like I got really close and pulled one off and it had fleas, the stick tight fleas that you guys have here in California stuck all over its comb and waddle in its face. So I treated it with Revolution. It worked great. So
If there's no active problem though, do you recommend like dog and cat giving it every 3 months, or is it kind of just as needed?
nope. So only if they go outside, which I don't recommend. So then I'll say like monthly treatment is probably required. Obviously, here in California, it never really gets cold. I know some of you guys think it's cold, but like not really. So, nothing dies. And so the fleas are just like a constant problem here. So I'll have people that are like, how did he get mites? He stays inside all the time. And it's because we bring them in on our shoes and clothing and things like that. So, and they just get in through the window cracks and things. And um, so sometimes we do have to treat them, but it's more usually I treat them on an as needed basis, but it's usually once and then in 3 weeks if they do have like active infection. But if they go outside, they need it. Or if you have cats and dogs that go outside, probably a good idea to treat them then too.
All right. Mine's just kind of a basic question. Are you recommending like annual exams for all of these animals? And then like, because I imagine it's probably stressful, especially for like birds to be transported and stuff. So that's why I was kind of curious, like how often are they coming in?
Yes. So I do recommend that they all get annual exams. Um, with our rabbits and things like that, as they start to get middle aged, I usually say twice a year exam so that hopefully we can mitigate some of the like kidney disease, liver disease, things like that. It is stressful for our birds a lot of times to be transported, but I still recommend that they come in to get checkups. If it's a new bird, what I'll often do is just do a very basic exam. Let them we try to do as much like fear-free with our birds as possible. And then unless there's something actively wrong, I don't generally recommend doing any sort of testing that day. I'll say bring them back in a few months and then we'll do blood so that we're only doing one thing kind of at a time and trying not to stress them too much.
Anyone else? Other questions?
I mean, there's like a million things that we didn't even touch on because I knew like it was going to be already over time. So, but if you do have questions, you can always grab me. Oh, no. Yeah, absolutely. Okay.
Wait, I have one. Can you
Yeah,
guys
I was
hear
just
me?
gonna call on Gabby.
Okay, cool. Sorry, I don't know like how much of the chat is visible or anything. But so you mentioned like guinea pig GDVs. Uh I know you mentioned that surgery isn't typically successful in them, and like especially if you try and do like a PEXI and stuff like that. But did you mention like trocherization or like orogastric intubation, how they do in dogs?
So we cannot trocherize hind gut fermenters. It just does not go well because of the amount of food and things like that that they have in their GI tract. I've often thought about that, like, well, they're going to die anyway, but studies have shown that it just does not go well in these guys. As far as, so sometimes we will put in an NG tube, but the thing that you have to remember is in guinea pigs in particular, we're using like a 3 French red rubber. So it's so tiny that they get clogged really, really easily. So you can try to find the pocket of air and like suck as much as you can out. And I actually did that in a rabbit once. That was not a good surgical candidate. I just like NG tubed it. You do it the exact same way as you do in horses and cats and dogs and things like that. And then sucked all the air out and was like, fingers crossed with meds and things that they'll just do. And actually that rabbit did fantastic. It wasn't a GDV, it was just a bloat. But yeah, so you can do that, but the problem is that oftentimes it's not just gas that's in there. There's like a lot of like hay and things like that, which is clogs up your tube really easily. So in rabbits that have stasis and bloat, if we end up needing to decompress them before surgery, we anesthetize them and pass an orogastric tube. And even that, I'm using like a 15 sometimes, or like, well, no, maybe not quite that big. A little bit less than that. Sometimes a 12, and I cut bigger holes into it, and still it gets clogged. You have to constantly like remove it and flush it and then replace it. So, and that's for an orogastric tube.
All right.
More questions?
Any more questions? No? All right. Thank you so much, Dr. Wills.
You are welcome.
All righty. So we can go ahead and head down to the commons for lunch. And then we'll go ahead and bring the raffle items downstairs.